I did it. Great.
We did it. And I gotta do one more and then we can start. Dude.
And then Maya, do you want to hit the present button?
Oh yeah.
Oh, perfect.
Is it loss in pregnancy or miscarriage?
Miscarriage.
Okay. I just realized that how many apps I have like open. I was teaching another class last night, so girls class. So everybody, welcome. My name is Suad Farole. I wanted to welcome today our Saturday class at Mommy's Corner. I also wanted to welcome Dr. Amelia, Dr. Blake, and Dr. Maya from Swedish Providers. Yay! My favorite. And also, I just want to welcome the women who are enjoying us from Zoom and those who are joining us from Facebook Live. If you have any question, please put it on the chat. And those of you who are in Facebook Live, if you have a question, please put it on the comment area, and then I will be able to read it and then answer your question as possible. And with further ado, welcome doctors, and thank you for coming today on this amazing weather in Seattle. Yeah, we can start. And today's topic is miscarriage and pregnancy, and early on, I think 20 weeks.
Mm-hmm.
Yeah. The floor is yours. Awesome. There's 3 of you, right? Did I miss one person? No,
you got all 3. Yeah.
Oh, yay, I did it.
Good job. Thank you. Thank you for welcoming us here again every month. It's such a pleasure for us to be here. And so at the last month that we were here, we talked about first trimester pregnancy, and people expressed interest on talking more about miscarriages and pregnancy loss. So that's what we're going to chat about today. So the first question that we want to chat about is just what is a miscarriage? And Maya, we can go ahead.
Yeah, should we do quick intros?
Oh, sure, we can do intros. Yeah.
You guys can do popcorn intros.
Yeah.
I'm Maya, or Dr. Siegel. I'm a third-year resident, and my clinic is up in Ballard.
Oh, great. Awesome.
I'm Amelia. I'm a third-year resident as well. We're all family medicine doctors, by the way. So we see pregnant people, we see all ages, we see kids. And my clinic is in First Hill, right next to Swedish Hospital.
And my name's Blake. I'm also at the First Hill clinic with Amelia, and I'm a first-year resident. So I'm the baby intern.
Okay. Awesome. Welcome, doctors.
Thank you. Okay, so just to clear up some terminology, miscarriage and pregnancy loss are actually one and the same. They're just different terms for it. Another term that people say is natural abortion. Any of those all mean the same thing. And specifically what we're talking about is when a pregnancy ends before the person has been pregnant for 20 weeks. So that's the 20-week delineator is just right in the middle of a pregnancy. Pregnancies typically last till 40 weeks. So up until 20 weeks, it's called a miscarriage or a pregnancy lost. After 20 weeks, it's typically called fetal demise. And that's a whole separate conversation. So we're going to talk about the first 20 weeks miscarriages that occur there, because those are the most common. And of miscarriages, they're exceedingly more common in the first trimester. So that's up to 13 weeks. So one thing that I really wanted to emphasize today is, I think in a lot of cultures, miscarriages and pregnancy loss is looked at with some guilt and shame, and not a lot of information is available or at least openly discussed. And there are a lot of possible reasons for that. One could just be the grief associated with it, but another is that we're not as open about it despite it occurring so commonly. So 1 in 4 pregnancies end in miscarriage. So that's of every pregnancy across the globe, 1 out of 4 of them will end in miscarriage. So it women in their 20s, 10% of them will have experienced a miscarriage at some point in their life. And then women over 45 years old, 50% will have experienced a miscarriage at some point in their life. So it is very common, but again, there's a lot of unfortunate shame and guilt that's associated with it. So our hope today is to, by chatting more about it, providing more education, and opening a space to discuss, we can at least start the process of trying to break that apart in our own community. Many miscarriages happen before a patient even knows that they're pregnant. And again, like I said, it's most common early in the first trimester. So that's before 13 weeks and usually pretty earlier than that. And 1% occur after that. So it's way more common to happen in that first trimester. The most often question we get is, why did I have a miscarriage? And so we're going to chat a little bit. We won't go into too many details because there are multiple reasons. But what I want to really narrow down, what I want to be really specific about here is that the most common cause of a miscarriage is a fetal chromosome or genetic abnormality that would have caused the fetus to not have been able to be independent regardless. So all that happens is while the cells are developing, after a few weeks, they kind of hit a stop point in their development where they realize they don't have the genetic code or the proper alignment of things to continue. And so that will be the end of that pregnancy. And that's what we would call that's a miscarriage. I really specify that with my patients, that it's nothing that the parents did wrong. It's nothing, that is an error when it comes to those chromosome abnormalities. It's just the randomness of the way our genes and chromosomes come together, that sometimes there is errors that then causes a miscarriage. Less common are problems with mom and dad. So I want to go into that a little bit. There's nothing you can do to stop a miscarriage, but we do have some risk factors here. So the first risk factor is age. So if it's greater than 35 years of age is the strongest association with those chromosomal abnormalities that I was chatting about. A prior pregnancy loss increases the risk about 1.5. So we're going to talk about that a little bit more if there are multiple miscarriages. And then medical conditions are a big one. So this is where we recommend really talking to your doctor to try to optimize your medical conditions or comorbidities before attempting pregnancy. In particular, diabetes, obesity, thyroid disease, and thrombophilias all are associated with an increased risk of pregnancy loss. And acute infection can also cause some stress on the body, and any sort of chronic traumatic stress or anxiety are also linked with increased risk of pregnancy loss. So those are all just things to keep in mind. If you have a stressful situation, that does not mean that you cannot get pregnant. It just means that it might be at an increased risk of miscarriage, but working with your doctor is the best thing to do there. Medications, if you're on a long list of medications, I won't go into the certain ones that we avoid or recommend. That's really what you can work with individually with your doctor. And substances, in particularly smoking, caffeine, and alcohol, all have a dose-related risk with a miscarriage. So we always recommend patients cut those down or preferably out prior to attempting pregnancy. And then there are some environmental factors, problems with the structure of the uterus. So if you've been told you have fibroids or a unique shape of your uterus, that can just be a bit of a barrier to getting pregnant and to keeping a pregnancy. And then lastly, what I wanted to talk about is race and ethnicity. It's been cited before as a risk factor for miscarriage. Specifically, studies consistently report that an increased risk of pregnancy loss exists in Black, Indigenous, and other people of color compared to white people. However, we think very strongly this difference more likely reflects the impact of cumulative stressors of systemic racism, social determinants of health, access to healthcare, and like I said, those situations that lead to chronic stress and or trauma can also increase risk. So there's nothing about those people that in their bodies and their uteruses that are not keeping pregnancies as well. It just has to do with a lot of the social determinants of health that we as a community, society, system are really hoping to break down. but it is still unfortunately disparity for sure. So the most common symptoms of miscarriage, so that's the next question we get asked, is how do I know if I'm having a miscarriage? So the two most common and pretty exclusive are the vaginal bleeding. So that's any heavy vaginal bleeding at the beginning of a pregnancy, and or belly pain or cramping. That's something you want to talk with your doctor right away. Those occurring does not mean you're having a miscarriage. It just means that you should be checked and evaluated. Sometimes when the fetus can implant into the uterus wall, it can cause a little bit of bleeding, and that's totally normal. Other times it could be the sign of what we would call a threatened miscarriage or an ongoing miscarriage. So again, if you have either of those, I recommend talking to your doctor. Okay. And I think I'm on this one too. So the question, am I having a miscarriage? So those bleeding or pain, they can happen in a normal pregnancy, but what you're going to want to do is talk to your doctor. And things that your doctor might do to confirm whether or not you're having a miscarriage is a physical exam. So they might do a pelvic exam. And the main reason for doing a pelvic exam on a patient is to look at your cervix and see if your cervix, which is typically closed at all stages of pregnancy until you're reaching the point of delivery, if the cervix is open a little bit, that could be a sign that a miscarriage is impending or has already happened. And so that's one thing that they want to take a look at. Another thing that they'll do in clinic is an ultrasound. And what we have here are two ultrasounds. The one on top is an example. Oh, awesome. I think I can see your pointer, which is great. The one on top is an example of an active miscarriage on ultrasound. So what you're seeing there, the outline shape is a uterus. In the middle is where we would typically see a gestational sac in the uterus. And at the bottom, it's really hard to tell, but there's just some fuzziness that for us is evidence of an open cervical os. So the cervix is a little bit open and there's some material in there that would suggest a miscarriage is happening. Below, you can see a normal active in what we would call an intrauterine pregnancy. And that is the uterus has the yolk sac and the gestational sac that are holding on to the fetus. So you can compare those two. That's just something that we look at on ultrasound. And then lastly, your doctor may or may not be doing blood tests. Major reason for that is to one, check in on your blood counts and make sure you haven't lost too much blood. And two, to check in to see if you need a certain medicine if you are having a miscarriage to prevent complications on further pregnancies. So those are all things that you can expect if you were to talk to your doctor about this.
And I just wanted to quickly add to that the symptoms of bleeding or abdominal pain can be something that can happen and your pregnancy can continue, can indicate that maybe something is going wrong, like a miscarriage. Can also, when you're early in pregnancy, if you especially have pain on one side or the other of your belly, can indicate that possibly that the pregnancy is not in the womb or the uterus, but in maybe the fallopian tubes or outside the uterus. And that can be a really dangerous thing to have happen. That is not a pregnancy that can continue viably. And that's also something that needs to be medically taken care of, because if that continues, it can cause life-threatening bleeding or damage to other structures in your body. So that's called an ectopic pregnancy, and that's something that can sometimes have similar symptoms and is very important to get checked out about, because that can have dangerous complications. And often that's why the ultrasound is so important, because if you've tested positive for pregnancy at home, the next step is really determining if that pregnancy is inside the uterus and making sure that that is a safe and healthy place for it to continue. So I just wanted to add that.
Mm-hmm. And the rates of an ectopic pregnancy are like less than 2%. So they're pretty rare. But it's, as both Amelia and Blake said, those would be emergencies. And so especially if you're having signs of a miscarriage and it's more on one side, like on your right side or your left side, that would be more worrisome. And so there's lots of terms that people use to describe a miscarriage, and I'm just going to mention these briefly. These are the terms that often medical providers will use, and so it's not something that people need to have memorized, but you may hear these used, and that can be sometimes confusing or frightening. One of the big ones is so a threatened miscarriage, or also in medicine, miscarriage and abortion are often used interchangeably. So a spontaneous abortion is the same as a miscarriage. It means it's abortion just means a pregnancy ended. So a spontaneous ones means that your body did it on its own, which is a miscarriage. So if you hear the term spontaneous abortion, that's what it's referring to. And so we often will say threatened miscarriage or threatened abortion. And that means that someone's having the bleeding and we don't know if it's a miscarriage, or we don't know if it's just some bleeding and the pregnancy is still going on. The cervix is still closed, and so the person is still pregnant at this time. An inevitable miscarriage means that there's more bleeding, there's more stomach cramps, and the cervix is open. The pregnancy is still inside of someone, but because the cervix is opening, which is the connection between the vagina and the uterus, and really the protection from the uterus from the outside world is open, a miscarriage is happening, and there's nothing we can do really to stop it. And then a miscarriage is when a miscarriage has happened, but your body hasn't removed or expelled the tissues of the pregnancy. And so if that happens, we would need to do a procedure or medicine to help get those tissues out. And I'll talk about that more in a little bit. Incomplete means that some tissue still remains in the uterus. If that's the case, we would also do the medicines or the procedure, which we'll talk about. A complete miscarriage means that everything has come out. The uterus is entirely empty. The person is no longer pregnant. And a septic one means that there's an infection, because either everything didn't come out, because it was incomplete or missed, there's now an infection in the uterus, and so we need to treat that infection to make sure that the pregnant person does not get sick. Also, please feel free to interrupt us all with questions or comments. Since I'm sharing the screen, I have difficulty finding the chat, but please feel free to interrupt me. And Amelia and Blake are both watching the chat. So
I'm watching the chat. I don't see any questions.
okay,
Go. But I have a quick question though,
yeah.
Because this term abortion and these other terms, they kind of if I were to be at the doctor's office with my spouse, and because most of the time we as a women, especially women who I mean, us who are in the medical field, we know these terms, we hear them over and over and over and over again. But if I'm just an ordinary woman and I just show up with my husband, and this is just happened to me, or if I show up with my aunt or my uncle, I mean, or just my friend or somebody who doesn't even speak the language, and I hear this word abortion, automatically the brain goes into another level. So if a doctor said that word, they might take it into like, wait, no, I didn't have abortion. My baby died, inside of my stomach. So it could kind of get out of context. What do you guys think?
Yes, and that's why we brought it up today, because the medical terminology is not often what people use in day-to-day things, and so it can be very upsetting if you if you come in because you had a miscarriage and someone says, oh, so you had a spontaneous abortion, because those mean the same thing, but when we hear it, especially with how certain people view abortion, it can be a very emotional response.
It is.
And so that's why we wanted to make sure that we mentioned that in medical terms, a spontaneous abortion is a miscarriage, because abortion just means a pregnancy has ended. Yeah. Whereas what we would in layman's term call abortion, we would say a therapeutic abortion, meaning that we are doing something to end the pregnancy, whereas a spontaneous one is your body has ended the pregnancy because of the reasons that Blake has discussed.
Yeah, because
so it's also a great reminder of, like, as doctors, the language you use is not always what the patient hears. And we need to be mindful of that as well. And especially since now a lot more people can read their charts. If they have the online thing, and really recognizing that the language that we use with other doctors to communicate more efficiently and to prove that we spend the hundreds of thousands of dollars on med school, when patients read that, they may have a very different reaction, and really being aware of that.
Yeah, I remember a long time ago, I was a medical interpreter, and boy, when the doctor used that word spontaneous abortion, I tried to interpret to the patient, and this was a long time ago before I became a doula, and I couldn't. It was hard, and the doctor that was on the OR that time, I mean the ER at that time, it was a he. He was not culturally, good at it, those kind of things. So yeah. So, but I'm glad you guys brought this up. I'm glad.
Thank you. And thank you for saying that too, because I think that we as, in the medical field, like always need to be thinking about the language we use, and like Maya said, and sometimes choosing words that are more patient-centered and more that make more sense to more people. But just in case you guys see any of these words, we just wanted to define them here so that there wouldn't be, hopefully we can avoid confusion.
Thank you, guys.
And so if someone is having a miscarriage, and it's not just a threatened one, but one is actually happening, kind of what can we do? And that's a question that often people have. Is there anything that we can do to stop it? So if a miscarriage has started and the cervix is opened, there's really nothing that we can do at that point, especially if they're having bleeding and cramping, to stop a miscarriage that's already started. And that can be devastating to some people, but also reminding you that most miscarriages are due to something in the genetics when they came together randomly that time that makes it so that fetus would not survive to the end of pregnancy, would not survive on its own. So it's kind of our body's mechanism to making sure that things are going well.
And sorry,
that-
I just wanted to interrupt you just really
please.
quick to say, this is one of this is also specific, and like we said at the beginning, of pregnancies up to 20 weeks. And so pregnancies after 20 weeks are different. And this is especially another kind of reason why is that, if you are having a concern for a loss, or your cervix was opening and you were beyond 20 weeks, there's a whole different thought about that. And that doesn't mean that your pregnancy is going to end right then. There's a lot of other things that can be done. So this is specifically first trimester early pregnancy.
Yeah, thank you so much for that clarification. That's very true. And that if you have a miscarriage, the fetus and the other pregnancy tissue does need to leave your uterus to prevent bleeding and infection. And so there's three ways that we can treat and take care of someone who's experiencing a miscarriage. We can wait. There's medicines that we can do, and there's a procedure that we can do as well. And I'll go through each of those a little bit more. So waiting is just allowing the body to pass the pregnancy and the tissues naturally. You can stay at home. There's no invasive treatments. It can take a while. It can take days. It can take sometimes a week or so. And it works about 80% of the time. But that does mean that 20 to 30% of the time, someone will need medicine or a procedure to help remove what in medical terms we call the products of conception, but what is the fetus or the embryo at that stage. If bleeding or infection occur, it's an emergency, so we would have you go to the emergency room. But a lot of people are able to manage their miscarriages at home without having to medicalize it as much. And a lot of people like it because it feels much more natural. Because it is so common. It's something that people have been going through for, centuries and millennium. And so a lot of people do like that option, and they're also able to be comfortable. They're able to be at home and be surrounded by their support system. But something else that we can do is take medications and do a procedure. And I also want to mention that both the medicines that we use as well as the procedure that we use if someone is having a miscarriage are the same medicines that we would use for someone who's choosing to end their pregnancy with an abortion. They're incredibly safe, and there are very few complications. And so if someone is taking a medicine to help after a miscarriage is started, often we'll use either mifepristone and misoprostol or just misoprostol. It helps the uterus cramp and contract to help expel the pregnancy. You can take, especially the misoprostol, you can take that at home in the comfort of your own home. And especially in the first trimester is highly effective, and most people don't have any leftover tissue or any leftover parts of their pregnancy. And so this is used to manage miscarriage. And then something else that we could do is a very common procedure. Once the miscarriage has started, it's the uterus is emptied via suction in a simple in-office procedure. It is incredibly effective. And is the fastest way. It takes, less than 15 minutes from the start of the procedure to the end. And so a lot of people really like that. And because people are able to, go home knowing that their miscarriage is over and that the chance of infection and bleeding then are lower. It is the most invasive. It requires a visit to the doctor. It requires a procedure where they do put an instrument inside your uterus. But some people like the finality of it and not having to wait days to weeks for the miscarriage to be over. It's incredibly safe, and it's the same procedure that we would use to end a pregnancy if needed, for other reasons. Any questions about those? Because I realized that section was a little bit more medical heavy and is often the part where people want to know more details.
Sorry guys, my mother-in-law was here. Yes, سؤال قبو أنت كجرو قبله. سؤال يا قبو. قف سؤال قبو من كجرا أنت. Any questions قبله? Okay, we can move next. Maybe
Okay, perfect.
at the end, inshallah.
Okay. So the next question people often ask is, what do I do after this process, of whether that's, after the miscarriage is done, after everything has left the body, and now what? And so the kind of medical advice we give is to prevent any infection, because the cervix or opening to the womb is a little bit open still sometimes, to not have anything inside the vagina for 1 to 2 weeks. And that means sexual intercourse, that means a tampon. And so, and just making sure to avoid infection. That's kind of the conservative thing to do. The next thing is talking to your doctor through this process. Your doctors will be interested to kind of keep checking up on you, especially like many people who kind of do this part at home, checking up periodically to make sure that this process has completed in a safe way. And some people choose to go on some sort of contraception or birth control after this, talking about what the best options for that after this. And some people choose that they want to try for pregnancy again. And that is something that can be done, pretty soon after a miscarriage is done. And then the other important thing is seeking support. This is something that so many people go through, and you can go to the next slide, Maya. And it's, grief is a normal part of this. There is so much, we don't talk enough about pregnancy loss, whether it's miscarriage or later on in pregnancy. I think we would all be surprised if we we're more open about it, about who in our lives have experienced this, and sometimes talking about it can help that. So especially if this is a really desired pregnancy, this can be so hard when someone has a loss. And I think that this talk, we wanted to really talk about how this can be very common, and it can also mean that you can get pregnant again, that this doesn't mean that there's something wrong with you. And so going to the next slide. And so, yeah, so I think it's important to take care of yourself after going through this. If you're not ready to talk to other people about it, friends and family, just, being with people, treating yourself gently, and just processing this experience. There's a lot of, at the end, I kind of, we have a couple of resources of like hotlines and things like that of folks to, that people can reach out to, but I also think that the Global Perinatal Services is another wonderful place to seek support in this community. So, and then going to the next slide, in terms of prevention, we talked through about what this means and what you can do when you're having it. And unfortunately, because this is so common, and the most common reason why is because this is a pregnancy that kind of didn't develop correctly and just isn't going to continue longer than a handful of weeks, is that there's nothing much that one can do about that random event of a kind of genetics aren't working together right, and the body says we need to try again. So, the things that you can do is working closely with your doctors, with other birth workers, and avoiding, like Blake said, cigarettes, alcohol, other drugs like cocaine, and abdominal trauma. And then also, like some of our other talks, we've talked about, making sure that you're healthy, and that you're in a good place to become pregnant, and talking to your doctor about that can help. Talking to your doctor about avoiding certain infections, and also avoiding medications that can lead to, or can possibly give you a higher risk of having a miscarriage. Okay. And then, so in terms of things that people may have heard could cause a miscarriage that do not, that I wanted to clear up. Exercise is something that we do encourage people to continue. Nothing incredibly strenuous, but at the same kind of level that you normally do, or even a little bit more, is perfectly healthy for pregnancy. If you've previously had a first trimester abortion, in terms of previously and choosing to end your own pregnancy, that does not put you at higher risk at all for having a miscarriage. That is very safe and not something that would put you at higher risk. Having sex, air travel, contraception, including the morning after pill, those do not cause miscarriage. The morning after pill, it may not work, but it won't cause a miscarriage. And so one other thing that we'll talk about next is what if you haven't just had one miscarriage? What if you've had recurrent miscarriages? And we usually think of that as someone who's had 2 or 3 or more. So like 3 or more miscarriages. 1 or 2 can be normal, and 3 or more, we might want to investigate a little bit more into why. If there's an underlying cause that can be treated, and try to treat that to help with fertility and pregnancy in the future. So that would be a conversation with your doctor as well. If you've had miscarriages in the past, your doctor might recommend taking prenatal vitamins before pregnancy and a low-dose aspirin before and during the next pregnancy. I wouldn't take that unless your doctor recommended it, but that might be something that is recommended to you. And then
I would take the prenatal vitamin though.
The prenatal, yeah. Take them all the time.
Before you get pregnant. Yeah.
Everybody just take a prenatal vitamin. Why not?
It makes your skin and hair look really good. I have some male patients on prenatal vitamins because it makes their hair and skin look good. So like everyone can be on a prenatal vitamin. There's no harm.
Did you say
taking
male patient?
Yeah, because it made their hair nicer.
What?
They have no intention of getting pregnant. They can't. Physically impossible, but they notice that it improved their hair and their skin, and so they take them.
I have a female friend who is my age and is not having no more babies, and she said that she never got off the prenatal since she have been having her babies, and she says she likes them because the way it makes her feel, her body and her hair and her overall, just amazing. If I can only get some of my clients to get that point, that'd be great.
Exactly, for everyone.
Yeah.
So some of the reasons someone might have recurrent miscarriages. We talked a little bit about genetic problems being one of the main causes of most miscarriages. And when we're talking about that, we're meaning like these random kind of, as the sperm and the egg come together, the way that the genetics mix to make to make the embryo and fetus, like there might have been some mistake or error in how that came together. But what I'm talking about here with genetic problems is that possibly the two parents might be carrying a gene that once mixed together in an embryo or fetus is incompatible, or something like that. And so sometimes what might happen is that if there have been a few miscarriages, doctor might recommend doing some genetic testing and might send you to a genetic counselor who's someone who is trained to talk through these complicated genetics in a accessible way, and can kind of counsel you on what tests to get, what those tests might show, and what you might do with the information you get from those tests. Some other problems that might cause recurrent miscarriages would be if there's something in the uterus or anatomically in the uterus that is maybe different. And so I think Blake brought up before fibroids. Fibroids are incredibly common. Fibroids are a growth inside the uterus. And many people have successful pregnancies and have fibroids. So having a fibroid doesn't mean you're going to have a miscarriage or have problems with pregnancies. But if you're having recurrent miscarriages, there might be a recommendation and you have a large fibroid, or your uterus is shaped in a certain way. And by that, I mean that there could be different growths, like a membrane separating your uterus into two parts. Some of those types of things can be surgically taken care of. And if that's what's kind of causing recurrent miscarriages, then often successful in then going on to have a full-term pregnancy. Medical problems, like Blake touched on before too, making sure that if you have diabetes, if you have thyroid disease, polycystic ovarian disease, and some problems with like blood clotting, some autoimmune diseases, those are all things that it's important to make sure are getting treated and managed as best that they can be, because if they're not treated as best they can, then sometimes it can lead to miscarriages or difficulty getting pregnant. And then, you know, as always in medicine, there's things we just don't know, we don't have answers for. And so unfortunately, for those people who have, you know, 3 or more miscarriages, about half of them, you don't know why. There's not a good answer. Often people can still go on to have successful pregnancies and never know why they've had a few miscarriages. But sometimes there's other things that can be done, and those things can be more like kind of fertility, or getting an embryo or getting an egg from another donor, things like that. That would be kind of more extensive to talk to your doctor or talk to a fertility expert about. I think I saw a question in the chat.
Yes, I found the chat and I'm
Yes.
typing an answer right now.
Oh, good.
It popped up. I figured it out.
Thank you, Dr. Siju.
Okay. And so this brings to the next point. You know, the next really common question is, well, what does this mean for my future fertility? And am I going to be able to have a full-term pregnancy after a miscarriage? And the answer is probably. And so we have some numbers here that I'll go through. So 43% of the people who have had a child or had a successful delivery have had 1 or 2 miscarriages. So that's a lot of people who have gone on to have babies in their past, have had 1 or 2 miscarriages, which means that they were able to get pregnant again and deliver a baby. And then, you know, 85% of people who've had 1 miscarriage will go on to have a successful pregnancy the next time. And then 75%, a little tiny bit lower, with 2 or 3 losses, will have a successful full term or term pregnancy as well. And so that is, you know, that's just to show that oftentimes that this is something that is normal, and something that does not mean that you aren't able to get pregnant or have a baby. And I think that's important to keep in mind. And
Something I don't mean to interrupt, but something I realized that we didn't discuss, and if people would like this discussed, let me know, of like, what does it feel like to have a miscarriage, and what might you see when you are having a miscarriage at home? If we don't have a slide for it, but that's also something that I realized that we kind of didn't really discuss, and I think something that people often wonder about. Is that something that people would like me to go over real quickly? Or I can just put in a good resource that discusses it in the chat, and people can find it on read through it on their own.
If you can go over quickly, that'd be great.
Oh yes, because we're nearly 6. Often you'll see some, depending on gestational age, you'll see some tissue. If you're below 8 weeks, you'll probably not notice anything that looks human. It may just seem like a more heavy period. You might see some clots. You may see something that looks a little bit like liver. That's also really normal. After 10 weeks, you might see something that looks dark red and a little bit like jelly. It may have a membrane inside of it. And if you're 12 to 20 weeks, what you will notice will be recognizable often as a fetus, depending on the gestational age, and if you notice it, or it may be inside of a clot. And you also may notice some water coming out before the bleeding does, and that's the amniotic fluid. And so all of those are really normal to experience. I'm going to include a link in the chat that talks about what people experience at different gestational ages, so you know what is normal. And then I also just want to make sure that we mention of like, if you're choosing to manage your miscarriage at home, other reasons to come to the doctor are your bleeding is very heavy, you're soaking more than 1 pad an hour for more than 2 hours, or you're passing golf ball size clots or bigger. You're having severe pain, you're having a temperature above 100.4 degrees Fahrenheit or 38 degrees Celsius. You're feeling dizzy, faint, like you might faint, that would be a sign that you're having too much blood loss. If you notice anything that comes out of your vagina that smells bad, that might be a sign that an infection is brewing. And if you start having severe diarrhea while having miscarriage, that's also a reason to let your doctor know.
Thank you so much. That's great. So it's question time. So gabdho, su'aal yaa qabo hadeertaanito. Aawe Khadija hadayt way soo wacday. You're out. You're in. ها macant waa kaa qaaday. Maxaa la dhahaa miidka ma ku jirtid?
For the gelatin, is that on the prenatal vitamins? Is that the question? Oh,
yeah.
It doesn't matter in terms of like from us as doctors. But I do know that it can sometimes be hard to find non-pork gelatin. And you know, as someone who also does not eat pork, it can be difficult. And so you can sometimes look at the brand. Some of them will be marked as kosher or halal, but I think they're sometimes harder to find.
Yeah, that's why I like New Chapter. It does not have a gelatin. Yeah, I use that brand. And also there's other brand that does not have no gelatin. As a matter of fact, I have one, I can grab it and share it with you guys, the name of it, but it's through private companies like Amway. I bought it from a friend of mine who was selling through here, and it's good. And
Amazon.
if you go to the vitamin store, they really know the ones that doesn't have a gelatin. They will actually point to you. Yeah, that's why I like going there, because if I wanted to something without a gelatin, they will let me know. It's a little bit expensive, but they'll let you know.
Also, Amazon does carry
Non-gelatin stuff.
yeah, vegetarian kind of vegan,
Yeah.
or they carry a variety, halal, kosher, all
Prenatal,
kinds of things. Yep.
prenatal. They have the K or the U. Yeah.
Yeah, and a lot of the halal and kosher ones use a fish gelatin.
Yes.
So it's using it of an animal. So if you're a vegetarian, it's not helpful, but it's pork free.
Yes, pork free. We can use something that is not a pork free. And some of the companies, when you contact them, they will let you know if it's the gelatin is made out from pork or any other animal. Yeah. أي سؤال؟ أبا خديجة السؤال ما قبتها حبيبتي. You say it's normal for women to have up to 3 miscarriages. She can still, it's normal? I did not know that.
may maqashaa sucaade
حبيبتي lagu maqlaa.
waxa headphone baa igu jiro waan waxba waadin maqli waa idinkana waadin maqli weydee
headphone saas waa wili.
hadda may maqashaa
Hadda waa lagu maqlaa macna.
maye waxay ka hadlayaan anay igu dhacday bishii labaad ayuu iga dilmay 2 bilood uuraan ahaa marka waxa ciladsadayna ma garanaynin kaasaa raba inaan ogaado.
I had a miscarriage. I miscarried and after the 2nd month, I think that is 8 weeks. I don't know what the cost. Can you ask the doctors what was the cost? And also, before I forget everybody, and I will explain this, there's a survey on the chat. If you can fill it out before you guys leave, that'd be great. And I will also help out with the Somali too.
So to answer the first question, which is, it's normal to have 3 miscarriages. So I would say that if you have 2, I would talk to your doctor, and that's kind of likely when you'd start thinking about
why,
more investigation into why, or if there's a cause that you can find out. But like with those numbers that are on the slide now, having 3 people still have been able to go on and have successful deliveries and pregnancies. So the range of, I think 1 is like common, and I would not, if one of my patients had 1, I wouldn't be too worried about it. If someone had 2, I'd say, let's maybe look into that a little bit more. And if someone was having 3, I'd want to definitely do some tests and things like that. But I don't think that I would be able to say you're not going to be able to get pregnant if you were to have 3.
Okay.
To answer the second question, the 8-week miscarriage, there can be many causes like we talked about. It's hard not knowing your personal medical history, but often an 8-week pregnancy or a miscarriage at 8 weeks is a really, is one of these things that we were talking about where it could possibly just be the way kind of the development was going. There's just maybe some mistakes in it, or just some random problems that came up that ended in miscarriage, and that it's nothing that was the reason, but it's nothing that you could necessarily prevent or do anything about, or anything you've done to cause that. Does that make sense?
It makes sense. But does it happen normally before 8 weeks? Because earlier we talked about that. You guys touched it.
Yeah.
Yeah.
Kind of.
8 weeks is super common.
Yeah, 8 weeks is super common for that. I'd say like even up to 13 weeks, that could still be happening. 8 weeks, definitely. And yeah, and I kind of like to think of it as it's the amount of genetic material that needs to combine to make a person is so complicated and so intricate that there's going to be some mistakes that happen, and that's going on in the early weeks of pregnancy. And so it's part of how how complicated and intricate just humans are to develop, and that it doesn't happen perfectly every time.
Yeah.
It's amazing it happens so commonly, like how often the body gets it right, considering how complex of a process it is for fertilization to occur.
باقي معناها سؤال هذه كجوابيان waxay tiraahday macnaha in bas bilaha ugu horeeyo complicated waaye in naagaha badanaa waa waqtiyada ee ilmaha ay soo tuuri karaan macnaha ay ka soo dhici karaan waa bilaha ugu horeeyo waa markii naagta ee ma arkino korkeeda uu ka raadinayo maxaa la dhahaa asi caawin ba afka Soomaaliga dhinacu iga gali rabaaye uu ka raadinayo nutritionka iyo maxaa la dhahaa sidii markano Ilaahay subxaanahu wa ta'aala ugu talagalay ilmaha abuuritaankoodii iyo waxoodii abaaqadii hadda ma ka soo dhinteen ilmaha mise cuniga horeeyay waa
may 6 sano kadib iyaan uurka yeeshay bishii labaad bay ahayd maalinkii 12kii bay ahayd bishii labaad 12keedii
bacdi uur ma qaaday
may intaa kadib maan qaadin ma waxaa keeni kara waxaad dhahdaa masalada oo kale may dabci karaan oo intaa qaybta ilma qaadadaas inuu ilmaha uu xajin waayo may dhici kartaa
ma try grace laakiin markii ilmaha ka soo dulmeen ka bacdi inaad uur qaadid
waan tiraagareeyay laakiin kadib waxa igu dhacay markay caadadu iga imaado haddana kadib inay wasakh badan iska socoto oon ku wareeray hadda bishan waxay iga istaagtaa adiga hadda bishii 9aad meelahaas baan xoogaa yara nadiif noqday.
It's been 6 years after the miscarriage. After that, I've been trying each time and I haven't been successful to get pregnant. And after the miscarriage, it's been really, really hard, even after my period. After the period, I have this issue where I bleed a lot. And with the bleeding, there's weird blood comes after my bleeding afterwards. And I don't know what's happening to me.
Yeah. I'm sorry that's that you've been going through that. That's really rough. I would recommend talking to your doctor about what's been going on. It's really hard for us to say what it might be just via video. But talking to your doctor, because especially if you've been trying to get pregnant for 6 years and haven't succeeded, your doctor should recommend that you see a fertility specialist. Who will do often a lot of lab tests, will sometimes do an ultrasound to really get a better understanding of why you aren't able to get pregnant again. And we recommend really anyone who hasn't been able to get pregnant in a year after trying to see a fertility specialist, because we understand how frustrating it can be if you want to have a child and you're unable to.
waxay ku tiraahday specialist oo fertility dhaqaatiirta oo loogu talagalay naagaha markino dhinaca specialist ah ilmaha sida loogu abuuro kale inay ku jirto waaye ku tiri si oo lagu diro ultrasound number 1 dhiig badan jirto oo naagaha laga qaadayo oo la fiirinayo the reason why uur u qaadi la'dahay and because waxa lagu talagalay markay ilmaha ka soo dilmaan sanadka bacdi ina uur aad qaadi kartid
waxba iimay dirin laakiin hadda wax dhiigaga horta laygama qaadin hadda October 29keedii baa waa la isaaray ultrasound way isaareen waa caadi wax kasta waa okay way ku dhaheen kaadi xataa infection waxba ma qabtid bishii July buu infection xun aad ii qabtay oo emergency-ga u galay kiniina isiiyeen dhiigaga iga qaadeen wax jawaabo saxana imay siineen.
In July, I had a bad infection where I went to the hospital and they did blood work and urine work. And they said I had a really, really bad infection and they did a lot of blood work, but the blood test, they didn't tell me a lot about what happened with my test, but they give me some antibiotic and some medication that I took home. But then I went back in August, I mean, not August, 29th of this past month, and they did ultrasound and they say everything was okay, but it was not a fertility doctor, it was my regular doctor. Then they told me everything was fine. I think you guys are right. You need to see fertility doctor.
Yeah, and often the blood tests that you do in the hospital because you have an infection are not the same blood tests that a fertility doctor would do, because it's every time we draw blood, we're not doing all the tests that exist in the world, because that would be millions and millions of dollars. But we really order very specific tests of what we're looking for. So often what a fertility doctor orders is very different than what someone in a hospital would order, because you're ordering them for different reasons.
Aba waxay tiri dhakhtarka oo lagu diraayo fertility dhakhtarka la dhahayo dhiigga ay ka qaadayaan iyo dhiigga caadiga oo laga qaaday isku mid ma ahan, because dhakhtarkaasayto only wuxuu eegayaa ukumahaaga iyo waxyaalaha oo ku saabsan uurka iyo minka meesha ilmagaleynka ah ayuu ku saabsan yahay. Marka dhakhtarkaas wuxuu kuu sheegayaa reasonka aad wax aad uur aad u qaadi la'dahay. Ma fahansantahay waxaan ku leeyahay? marka ayadee ku xiran tahay inay ku dirto fertility doctor ah. Marka insha Allah ana waxaan sameynayaa waa ku caawinayaa si ay dhakhtaradaada ee balan kugu dhigto fertility doctor.
insha Allah waa fahmay si fiican waad mahadsantiin aad oo mahadsantiin ku
Thank you so much, I appreciate it. Yeah, I will follow up with her and you know, to make sure that she gets the right doctor. Okay, yeah.
Northwest Fertility Northwest is one in Seattle that a lot of people have had success with. And then I see a question in the chat that I want to make sure that we address again. We talked about it a little bit. Is what is the medication and the procedure if your body doesn't expel the pregnancy on its own? So the medicine, the biggest one that we use is the misoprostol. It causes your uterus to cramp and contract, and that's then what expels it. That is the most common one used. If you have an ectopic pregnancy, we use something a little differently, but for the most common one, that's what we use. It's incredibly effective. It's over 90% effective up to 20 weeks. If you remember that doing nothing and letting your body pass it alone is up to 80% effective, and so this is more effective than that. And then in terms of the procedure of what would be a DNC, or also which is a dilation curettage, so that's a little bit of an older term because a curettage implies that something sharp is in your uterus, and we don't use anything sharp anymore. We use what basically looks like a soft, flexible straw that is attached to a small handheld vacuum, and it removes the contents of the uterus. It's incredibly safe. I can show you a picture of what that looks like. Let me try to change the screen that I'm sharing.
Just to add to Maya, so for the medication, oftentimes it's given, you know, you get it at your doctor's office, and then you can take it at home, and oftentimes that takes a few hours. So like it could take 4 to 5 hours. It could take a couple days, and that's something that is sometimes hard for people, is that the hours to a few days, and the small chance that it doesn't work, and that you might have to, if you're still bleeding, and if there's a small chance that it didn't fully get everything out, that you might need a procedure after all. But it usually would take 4 to 5 hours to 1 to 2 days, and you can be at home in a comfortable space. The procedure, with which Maya will show you kind of the device that's used, is something that some people find, you know, it's a little reassuring to say you can go into your doctor's and it can be over and you don't have to wait. But it's something that has to be done at the doctor's office, and that is with a speculum exam. And there's something that's kind of like a small straw that goes inside the uterus. And then there's a handheld device that kind of pulls the tissue out, so that that just kind of gets rid of everything that's inside. And so that is something that then you can kind of go home and know that it's over, although you do have to go to the doctors and have this done. So it's kind of one of those conversations that you can have with your family and your doctor to figure out which one's the best choice for you. Typically, the procedure, and this is the device on the screen now, is if the waiting at home, if the medication, if those weren't working and you're still having some bleeding or if you developed an infection or something like that, the procedure is kind of the definitive thing that would get done to make sure that everything is done and that everything is safe.
Yeah, and so this is, you guys can see it?
Yes.
Okay, perfect. So this is a uterus. Here's your fallopian tubes, here's your ovaries, and this is your cervix. And so it's like this, basically a straw, like it's pretty flexible. There's nothing sharp that ever goes inside your uterus. And that is going in, and this is just a handheld device, and you make a small little vacuum by pulling on it. And it uses suction to get the contents of what's left in the uterus of the miscarriage, and it takes it out, and then they look at it in the lab to just ensure that everything came out. But the whole procedure takes between 5 and 15 minutes.
And it can be a little bit painful. It can be cramping. All of it can be cramping and painful, whether it's over hours to days with the medication or even longer with days with just the waiting at home. And so the one in the office is often it's much shorter, but it might be more intense for those minutes.
Yeah.
And other question in the chat. Do we have time to answer that or?
We went over our time. سؤالك كله يا قبو. Anybody else have any questions?
Yeah, I can very quickly answer the one in the chat as well.
One in the chat, okay.
It does not affect your chances of having a healthy pregnancy. You ovulate before you have your period. And so often you have return of fertility prior to having your first period. So people can get pregnant really quickly before having a period in between. And that is normal. And so it does not affect your chance of having a healthy pregnancy. And I wish you congratulations, and that I hope you have the healthiest of pregnancies.
And I would just advocate, sometimes it can be hard to know how, kind of what gestational age or how long you're pregnant when you don't have a period that kind of marks that timing. So I would just recommend, if you haven't already, going to the doctor and getting an ultrasound just to get a good sense of how long you've been pregnant. Because those ultrasounds, around 7 to 9 weeks are very accurate to determining exactly where you are in your pregnancy. And that can be really helpful in terms of later on in the 3rd trimester, and knowing a good due date, an accurate due date can be really helpful for keeping track of your pregnancy and knowing that everything's going well.
I fully agree. Get that early ultrasound.
Yep, it's very important to have that early ultrasound. Okay, that is amazing. So سؤالي يا قبل انت نسيت انت دمينين كهور مغرب نوال الجوغاي قبل. Any more questions? Any last questions?
And I know Blake texted us and said that the power went out in our house. So just so sorry to have missed kind of the end of this.
Oh,
So
it's getting really bad around here.
So she sends regrets, but we thank you so much for having us here. We always love to be here and to answer questions.
Thank you, guys. So what we should talk about next month? I was thinking something like, the tests that you guys take. Did we talk about that? First trimester, the bunch of tests. Did we cover that up?
Oh, we talked about like genetic testing. Well, what we can do is we were thinking about maybe, since we did first trimester and now we did first trimester miscarriage, that we can do second trimester next time. And we can just talk about pregnancy in the second trimester, what's going on in the body and like what you might expect from your doctor.
Okay.
Does that sound like an okay plan?
Yes, I like that. That'd be great. So I wrote it down my note this time. Cinnamon, I'm going to text you.
Perfect.
Thank you so much, guys. I appreciate it. Enjoy your rest of the evening, what's left, and be careful out there if there's a storm out tonight.
Yeah,
Thank you so much for having us. I personally, selfishly, always really enjoy coming here. So thanks for
Thank
having us.
you. We love to have you guys in Mommy's Corner every Saturday. I mean, we're here, of course, yes. But we love to have you guys at once a month. And I'm excited too, whenever the month comes up, I'm like, yeah. Gabdho waa mahadsantihiin kulligiina. Anybody have a question?
aad baad u mahadsantihin Sucaad, waa maasha Allah. Mar kale haddii aad ku soo celin kartaan dad u baahan si ay uga faa'iidaystaan.
Sabti walba sabtida ugu horeysa imaanayaan sabtida ugu horeysa bil walba.
Insha Allah. Wixii ka faa'iidaysanaya waa u sheeg insha Allah.
ayadana information dhinac igu soo qortay anaa kula share gareynaayo insha Allah anaa ku soo wacay qadiid.
Haye walaal, jazakallah khayran. Haye.
Thank you so much, guys. Thank you very much, you guys. We appreciate it. Have a great weekend. If you haven't filled it up, I know you guys, most of you say thank you. Thank you so much. I will see you guys next week. Gabdo, waxaa noo imaanayaan and doctors. Next week, not doctors. Oh my God, I love my doctors. Next week, we're going to have a power of attorney. So yes, stay tuned. Thank you guys. Salam alaikum, everybody. Have a great weekend.
Alaykum salam.